Hello and welcome to another TLDR EU video. With most countries around Europe experiencing the beginning of what many are calling a second wave, we thought that it was time to go back and revisit one country's response to the coronavirus. A country touted by some as the way forward, and by others as the worst case scenario. So in this video we'll take a look at Sweden, what's changed since our previous video, and why it's coming back to the fore yet again. If you haven't already, please subscribe to the channel and hit the bell icon. Currently, TLDR EU is racing TLDR US to reach 100,000 subscribers. The US has a big start, but the EU is catching up, and fast. So do TLDR EU a favour and help us catch up with TLDR US, and do yourself a favour by getting notifications every time we release a new video. Sweden has been unique to say the least in its response to the coronavirus pandemic. Crucially, Sweden did not actively pursue a full national lockdown at the beginning of the pandemic. Although that's not to say that they sat back and did nothing. All the way back on the 1st of February, Sweden declared COVID-19 as a disease which constitutes a danger to society. And as we covered in our first video on the topic, while most countries went one of two ways, be that suppression or complete lockdown, Sweden chose a third way, allowing most restaurants, bars and primary schools to remain open, only closing the likes of secondary schools, banning gatherings larger than 50, as well as encouraging people to work from home, avoid unnecessary travel, and encouraging people to socially distance. This was an approach that was condemned by many, following projections from a model developed by Professor Neil Ferguson and Imperial College London, which predicted some 85,000 deaths as a result of the strategy. However, this is all nothing new. What's key now is the notion of a second wave, and whether Sweden's lack of lockdown has put them in a comparatively strong position going forward. Professor Mark Woolhouse, Chair of Infectious Disease Epidemiology at the University of Edinburgh, a member of the government's scientific Pandemic Influenza Group on Modelling, and a member of Scotland's COVID Advisory Board, has cautioned the British government from using a second lockdown, or even the use of circuit breaker mini lockdowns. Writing in the Telegraph, he stresses, "We must not allow the cure to become worse than disease. The long-term strategy has to be a risk-based approach to living with COVID-19. This is a very unpleasant virus, but for the great majority of people, not nearly so unpleasant that we should contemplate shutting down society to deal with it. We can help individuals assess the risk to themselves and the people around them, enable everyone to mitigate those risks while ensuring that the most vulnerable people are protected, and therefore minimise the need for government-led interventions." Would that work? It seems to be working in Sweden. So, is it? Despite coming under fire during the early stages of the pandemic due to ever-rising case numbers, while other countries are now seeing profound rises in cases leading to fears of a second wave, in Sweden, cases have been declining. Financial Times analysis, based on official data from across Europe, highlights just how stark the picture is. The 7-day rolling average of new confirmed cases in Spain stands at over 180 cases per million, having risen sharply over the last 2 months, and surpassing their earlier peak of just 160 cases at the end of March. In France, the picture is slightly better, but cases have still rocketed above 100 cases per million, again surpassing their earlier peak of around 70 at the beginning of April, and following a sharp rise since mid-July. Considering the EU as a whole, cases stand at just 50 per million, but again, this is on an upward trajectory. The UK has fared considerably better until now, with cases per million in the region of 30, down from a peak of 70 in April, but the slope of the line in recent days is pretty close to vertical. Only in Sweden are the numbers actually reducing, standing at around 10 cases per million and on a downward trajectory. This is, however, following 2 earlier spikes, one in line with the rest of Europe in April and May time, and a further one where, at the same time as other European countries were facing substantial declines, Sweden saw cases hit 100 per million. It is worth noting that the recent decline has been attributed to the slight tightening of restrictions, as well as the traditional shutdown for the summer. On the restrictions front, during August, according to the University of Oxford's government response tracker, the likes of Austria, Croatia and Norway all actually had fewer restrictions than Sweden, despite Sweden being hailed as the leaders in no lockdown. Considering the numbers from the European Centre for Disease Prevention and Control on their own, of the 31 countries surveyed, 22 had higher rates of infection than Sweden. New cases are roughly at the rate seen in late March, with positive test rates extremely low, at just 1.2% of the tests carried out last week, the lowest rate since the pandemic. Regardless, for many Swedes, Anders Tegnell, state epidemiologist, has become a rallying figure and has, in the words of the FT, come to embody a rational approach as other countries have appeared to sacrifice science to emotion. For Tegnell, the concept of herd immunity does come into things, arguing that Sweden will be able to maintain a low level of spread with occasional local outbreaks, compared to other countries which are likely to be more vulnerable to these kind of spikes. Those kind of things will likely be bigger when you don't have a level of immunity that can sort of put the brake on it. Despite this, he is at pains to stress that herd immunity is not Sweden's goal, just a convenient side effect. Tegnell describes the use of national lockdowns as using a hammer to kill a fly, emphasising that lockdowns will always be on the back foot. We don't see it as viable to have this kind of drastic closing down, opening and closing. You can't open and close schools. That is going to be a disaster. You probably can't open and close restaurants and stuff like that either too many times. Once or twice, yes, but then people will get very tired, and businesses will probably suffer more than if you just close them down completely. Sweden's approach has been considerably more holistic, leading to support from politicians across Europe, who have argued that lockdowns are, in Tegnell's own words, using a hammer to kill a fly. Yes, a complete lockdown may reduce and suppress the public health emergency in the short term, but what about the long term? The long-term closure of schools can have immense effects on educational prospects and even on long-term health prospects. Forced isolation can also have immense impacts on mental health, leading to discussions and arguments about an impending mental health crisis. Although that's not to say that their approach has been flawless. Key mistakes were made at the beginning of the crisis, with a major factor fueling the spikes in infection rates and deaths arising from the failure to protect care homes and other vulnerable people, a mistake admitted by Tegnell himself. At the time of writing, cases stand at over 88,000 and deaths just shy of 6,000 at 5,865. According to Peter Kasson at the University of Virginia's School of Medicine and Sweden's Uppsala University, concludes that Sweden's controversial decision to not lock down during COVID-19 produced more deaths and greater healthcare demand than seen in countries with earlier, more stringent interventions. Sweden's unusual approach also saw fewer patients admitted into intensive care units than expected, but the country has seen a higher percentage of COVID-19 deaths in older patients outside of ICUs than other countries, when ICU beds were not limited, leading to Sweden having a per capita death rate that outstrips even the United States. All in all, can we definitely say that Sweden's approach is the way forward? Put simply, no. No one knows for sure what the future holds for the crisis, in the same way that Sweden's approach was condemned with very little data available at the beginning of the pandemic. It cannot be supported on the very little data that we have now. After the 2003 SARS outbreak, it took years upon years for a conclusion to be drawn and lessons to be learnt. And while we can use the findings from that outbreak this time round, each and every pandemic is different and unique. But what do you think? Is Professor Mark Woolhouse correct? Is the second lockdown an example of the cure being worse than the disease? And is Sweden's strategy the correct way forward? Or do we simply not know enough just yet? Let us know your thoughts in the comments below. Be sure to subscribe to the channel and hit the bell icon to be notified every time we release a new video. Special thanks to our Patreon backers who make videos like this one possible. If you want to see your name listed at the end of the videos, just like Stefan C, Carol Kwan and Dominic Caputo, then be sure to back us on Patreon. The link to that's in the description.